All right, I'll get going just for the sake of time. My name is Hannah Szlyk. I am an instructor at Washington University School of Medicine in St. Louis. I started this project with Michael Anestis while I was still at Rutgers School of Social Work. I'm so happy to present today. And Lucy Nonis Barnes, one of the research assistants on this project, will also be presenting with me today. She's here with me now. And then also wanted to give credit to Devin Zeminski, who participated in an earlier session, who also helped us with this project. And so the name of our study is called Preventing Firearm Suicide by Phone, Examination of Mean Safety Practices Across U.S. Centers. Okay. So just a little bit about the next 30 minutes. We'll go talk about the background of the issue that we want to address, the goal of our study, a little bit of the mechanics and what we did. We'll talk about some of our findings, and then ways to move forward and next steps. Okay. And so for those of you who are new to suicide research and the issue of suicide in the United States, suicide is the 10th leading cause of death, and over half of gun deaths are deaths by suicide. And we also know that 9 out of 10 suicide attempts by gun result in death. And so obviously a suicide, a death by suicide that involves a gun means that, it's a very lethal means to die by suicide. So obviously having to address access to firearms is a really important aspect of suicide prevention. Okay. And so those of us who are in the suicide prevention field often talk about firearm means safety procedures. So there's several evidence-based practices out there to reduce suicide-related deaths. And these evidence-based practices are some of the best ways that we know to actually prevent suicide as well. And so we'll talk a little bit more about what those different evidence-based practices are. What we see kind of across the US is that there's actually a low uptake of means safety interventions across healthcare systems. So here we have an image of a lethal means safety evidence-based practice that is used by the VA. So this is something that they use to inform their service members, but they also have information for families. So here we have an example of providing people with, with gun locks, gun cases, lock boxes, in different ways, to store ammunition. There are several different evidence-based firearm means safety practices out there. And so as well, that you probably see information about the National Suicide Prevention Lifeline across the country. We call these crisis hotlines, lifelines, a lot of different names for these services across the country. And so what you've probably also seen is that there's promotion for new funding to actually have the suicide prevention number, the Lifeline number, to be shortened to 3 digits, 988. And this is actually happening this summer. And so, these crisis hotlines, including those that are part of this National Suicide Prevention Lifeline, are really a way for us in the US to really be kind of on the front line to address suicidal behavior and also save lives as well. And so, again, just something too that you might not know about the National Suicide Prevention Lifeline is actually this is made up of probably hundreds of centers that are across the United States. And so these centers are under the auspice of this National Lifeline, but really these are independent centers that then operate some services for this National Lifeline and also keep some data for the National Lifeline. But in actuality, these are really our centers that are local, very local to different parts of the country. And even going further about kind of the role of these crisis centers in terms of saving lives and preventing deaths by suicide. We saw during the time of the pandemic, as you can see with this graphic, that there was an increase in calls to these crisis centers, during the early months of the pandemic. A lot of people were in need of support to deal with the emotions and the stress of dealing with the pandemic as well. And we're seeing even greater need to have these crisis centers as a front line of suicide prevention and support for folks who are struggling with mental health. But also these centers might not be considered as not always utilized well as opportunities to prevent suicide as well, or even thinking about how they could be an opportunity to prevent suicide deaths by firearm as well. And so this is kind of where we came to the goal of this study, is that we really saw a gap in research and practice. So there really is little known about how crisis centers nationwide train their staff and use firearm means safety protocols for suicide prevention. And so some of you might know about the American Association of Suicidology, and this is a national association that actually kind of does accreditations program for many of these centers across the US. And according to them, there's among the centers that are accredited for part of AAS, there's about 4,000 full and part-time individuals. So really, we're thinking if we can train these individuals or make sure that they're equally knowledgeable and comfortable to talk about firearm means safety protocols, that is a great way to prevent firearm suicide. So we really wanted to even kind of know a little bit more about the knowledge and the state of the comfort of these crisis counselors to talk about firearm means safety. And so, like I said, some of our specific goals of the study were to examine crisis counselor knowledge and attitudes towards using means safety protocols through a broad survey of crisis centers across the US. And next, we wanted to explore perceptions of means safety use with callers at risk of suicide through interviews with select crisis centers. Okay, so really what our study included is something called the sequential mixed method design. And so that means that our survey outcomes then informed who we're going to interview. So starting in November of this past year through late January of, that should be 2022, we were able to reach 950 crisis center counselors across the United States. And right now we're in the process of interviewing select crisis counselors from the 4 regions of the US. And these are individuals who did provide completed surveys. So those that completed the surveys and informed who we're interviewing. And so right now, we have about 13 crisis counselors who've completed interviews, and our goal is to have about 12 crisis counselors per 4 regions of the US. So we have a balanced sample to base our findings on. Okay, Lucy, want to say a little bit about the sample?
Yeah, thank you so much. Oh, I'm echoing. Am I echoing for anyone else?
You're okay.
No, okay, I can handle it then. So for the survey portion of our study, we had 950 call center employees participate. The majority of these participants were white, non-Hispanic, female, and between the ages of 24 to 40 years old. So sorry, I just need to check these out. Is that better? Can you guys hear me?
Oh, Lucy, I think you might be muted. I think you're still muted. You can see your microphone still muted on our side. Well, I can take over for now while Lucy figures that out. Like she was saying, we found that most of our sample identified as female and was between ages of 25 to 44. And also a majority, around 70%, identified as non-Hispanic, and 35%, so at least just over a third, have reported that they had a graduate degree as well. Is it working, Lucy? No. Don't worry about it. It's okay. We'll just keep going.
Oh, wait, there we go.
There we go. Okay, so there you go. You can talk a little more about the centers.
Okay, so sorry about that, guys. So thank you for that, by the way. Almost half our participants worked at call centers in the Midwest region of the country. Although 14% of these participants did not provide the name of their call center. So there might be a little bit of a different range in terms of region if we had all of those answers. A third of the participants have worked at the center for 5 or more years. And most of these participant call centers serve adults, with many of the respondents checking off that they serve more than one type of population. So they might serve adults and adolescents and youth. 39% of the participants reported that their callers hail from urban areas. And if you see that only about 6% reported callers from rural areas. So there seems to be some kind of lack of either support or other reason why rural callers aren't reaching out to these call centers. So for our training part of our survey, 2/3 of the participants responded that they received some sort of formal training in reducing firearm access. So for our survey, we listed 3 options for evidence-based trainings: counseling on access to lethal means or CALM, safety planning intervention, and lethal means safety training, which, as Hannah mentioned earlier, the VA provides. Of the participants who did receive formal firearm safety means training, CALM was the most common training received. About half of the participants didn't actually know anything about their local restrictions on temporary firearm storage, or knew some laws but weren't sure about how secure they were or their access. So this is important because this is related to the legal methods of how somebody can not contain or not hold their firearms if they're in crisis. So if a caller calls and is in crisis and they need to give their firearms away, it's important for the call centers to know what the legal methods are for that. So on average, participants were only somewhat confident about speaking with a caller at heightened risk of suicide. So what does this mean? So for a max score of 18, we had an average of about 9 uh, confidence level. So there's really only average confidence about how to speak with a caller at heightened risk of suicide. And the same really went for comfort. So seems like the participants that we surveyed are not overly comfortable or confident or even likely to use their firearms safety protocols and trainings when speaking with a caller at heightened risk of suicide. They did respond overwhelmingly that they would be willing to use a new type of treatment or intervention and are very interested in further training and knowledge on firearm safety.
And I'll say a little bit.
So we did a preliminary. Oh, sorry, Hannah.
You can go right ahead, Lucy.
Okay. So we did a preliminary thematic analysis from the interview summaries. So our first topic that really comes up a lot is the anxiety and fear that our participants have when someone calls who has access to firearms. And so one thing we found was that people who either are gun owners or have been around guns often have a lot more comfort in speaking with callers about firearms. So I think we have a little bit of time. I'm going to just read some of these quotes because I think they're really important. And these are quotes from our interview. So I think the anxiety I mean, the anxiety is always higher when you've got somebody with a gun. But I think the lack of knowledge about how guns actually work is something that is really, really hard for people to get. And when first training counselors, the minute they hear a caller has a gun, they panic. And I think there needs to be more training that's really targeted toward helping the counselor to understand that, yes, it's higher risk, but it's not. So it seems like people who are either new to the field or not gun owners have a lot more anxiety and fear when speaking to callers about firearms. So another theme that oh, Hannah, do you want to take this one?
Yeah, I'll go right ahead. So another theme we saw too is that there's a lot of pros and cons of evolving technology. And so a lot of these crisis counters, even if they're in working at a local center, maybe in Massachusetts, they're actually receiving a lot of calls from across the country right now, which is exciting because they can reach more people. But also, some of the fear too is that these platforms and centers that they're working on are not really ready for the influx, especially from out-of-state callers. And then even with the 988 initiative that I was talking about earlier, the hope is that this three-digit number will increase people's comfort and knowledge of using this number when they're distressed. But again, this will also mean more of an influx of out-of-state callers or influx of calls to these really local crisis centers that often do rely on small staff and a lot of volunteers. And so here are some quotes that really reflect kind of the pros and cons of evolving technology while working at some of these crisis centers as well. So one person said, but unfortunately, since we're as a backup center with the National Lifeline, we get calls from centers based in New York. We get calls from Anchorage, from Texas. Another person said, we pretty much stopped taking chats from the National Lifeline due to glitches with the platform. So they have a chat platform for the National Lifeline right now too. And so, that stinks. But the hope is that the 988 will at some point be text enabled. So kind of hope that, some of the technology that will come with the 988 initiative will be more user friendly also for the person who's in distress, as well as for the crisis counselors themselves. And so we'll talk a little bit more at the end about how this might relate to implementing firearm safety protocols with these callers. Okay. And so something that also came up is that there's a need for alternatives to law enforcement. So a lot of old protocols for firearm safety initiatives at these centers included calling police, and many of the crisis counselors felt that this was outdated. Really thinking about how divided our country is right now politically, but also about comfort level in high profile cases involving murders and with the police. And so again, some of these protocols don't really lend to those tensions and these political crossroads which our country is at. And so there really is a need for more timely solutions to keep callers safe. And there also needs to be other strategies to separate a person from a firearm. For example, when a crisis counselor is talking to someone that has access to a firearm, and they're also talking about plans to take their own life, often, the counselor will try to have a way to separate the person from the firearm. So that might even be the best thing would be to give the gun and the ammunition to a friend to get it out of the house. But sometimes that even means putting the firearm in their car and locking the trunk. So here are a few more quotes that also, that exemplify this need for alternatives. So one person said, I think the area that we struggle with these calls is law enforcement. So actually having them go out and assess when there's a firearm involved. Another person said, I've never really recommended that. So calling the police to a caller, just the sense of somebody who is suicidal, who's going to police station and turning in firearms. It's kind of a scary concept right now. Okay. And so another theme is the need for additional training and also for the need for additional national resources. So a lot of people talked about the need for a national database So right now, even though these crisis centers are working as part of the National Lifeline, there isn't a lot of resources that can kind of unify all those crisis centers, or an easy place for them to find information, either about firearm mean safety training, as well as the different laws about firearm access, or even safe storage practices that can be specific to each state. And so, again, seemed like people really wanted training that is specific. So talking about maybe having a training that's mandatory, not just for their center, but also as part of the National Lifeline auspice, something that's annual, that's also apolitical, but also that talks about knowledge about how a gun works, since that might make the crisis counselor feel more comfortable with having these conversations, but they'll also be able to help the person's, remove the firearm from their immediate access as well. So one person said, I feel like guns would definitely be placed in that category where it didn't come up enough like that. Even if we had formal training, we were trained on so many things that might have just gone right over my head. So I think that even kind of speaks to the burden of the crisis counselor to hold a lot of information. And next, another person said, and so I think a lot of communities that we serve in our state don't necessarily see it as something dangerous. This is something that you have in your home that everybody needs to know how to use, how it comes with you, that you need to know. And so again, kind of, it's important for us also to know that, firearm use and access it differs across the country. It can have a different, cultural element depending on where you live and the people you serve. And so kind of wrapping up with some final takeaways from our preliminary results, we found that most of the crisis counselors that participated in our study were predominantly white, female, and non-Latino. So this workforce is highly educated. Over a third had graduate degrees, and most of this workforce has multiple years of work experience in this crisis center and crisis call field. And mainly they serve callers of all ages, specifically in the urban, suburban areas of the United States. And additionally, we saw that many counselors are comfortable, again, that comfort, but talking about firearm mean safety is very mixed. Some do feel equipped to ask about firearm mean access, but that can also vary a lot by center and by region. But there's less knowledge on what to do next. Specifically, having a lot of them did not mention having center-specific firearm safety strategies. This isn't part of their training most of the time. And they would like to know more about safe storage opportunities in their community, but also in different states in case they do receive, a caller from out of state, and also about alternatives to calling police enforcement as a way to deter someone from using the firearm to harm themselves. Okay, so I think also the study is pretty timely too, because as I said, with the 988 initiative happening now, and hopefully the growth and the prominence of the National Suicide Prevention Lifeline expanding, we also kind of have to keep in mind what this means for the burden of these local crisis centers and their staff too. And again, as firearms is something that is highly lethal, especially in a suicide attempt. We really need to think about how we can best equip these crisis counselors with training that really can serve the callers they have as best they can. And so, like I said, there seems like a theme that did come a lot is that there's a burden on crisis center staff. A lot of them are volunteer based. A lot of these centers, that's how they run, even though they might have full-time and part-time staff. A lot of the time they do rely on volunteers, and they're having to be responsible for lots of roles, lots of tasks, and also, personal knowledge about firearms varies a lot, and this varies by state and even county, and that this can also greatly impact their comfort level with having that discussion with a caller. And then I think even moving forward, we really need to think about staff burnout, as well as the need for more funding, staffing, and directives and resources that can provide that can be offered to these centers across the country. And so next steps for us, as a research team, is to continue with these interviews with their crisis counselors through the end of June. We hope to complete both our quantitative and qualitative analysis. And also, one really important goal is to disseminate our findings to our participants and also to the national crisis centers who participated in this study. Ultimately, we would love to provide recommendations to Vibrant Health, which helps run the National Suicide Prevention Lifeline, as well as to 988 stakeholders, and eventually maybe develop and pilot a virtual apolitical training that focuses on how crisis counselors can talk to callers in need about firearm safety. And additionally, it would be also wonderful if we can compile a national database on firearm-related resources by state so that crisis counselors have an easy and accessible way to have this knowledge when they're talking to a caller in need. And ultimately, hoping that our findings in this study can support advocacy for additional funding for crisis centers on the state and national level. So we ultimately want to thank our participants, the crisis counselors, and the crisis center staff that participated in the study. We also want to thank Colleen Creighton, Bart Andrews of BHR at St. Louis, Becky Stoll of Centerstone, and Travis Atkinson and the TBD Solutions staff that helped make this study possible and helped basically build the network to make this study, a fruitful study as well, and reach nearly 1,000 crisis counselors. And also, finally, we want to say that we really appreciate the support from the New Jersey Gun Violence Research Center at Rutgers that helped make this study possible. So here's my information in case you have more questions about the study, and we're hoping to disseminate and roll out more findings and implications for our findings in the summer and fall. So
thank you so much, Hannah and Lucy. It was a great presentation. I would like to thank you guys for joining us today. Also the audience for joining. We have a couple of questions. Maybe with the time, I'll just read one of them. Did you capture whether the respondents were paid or volunteer staff? I worked at a hotline that received Lifeline calls in Florida, and we had over 100 volunteer hotline counselors.
So that's a great question. In the survey, we actually didn't ask if they were paid or not. Originally, we were trying to recruit people who were just paid staff, but in terms of just getting a diverse sample, we ended up having some volunteers. But I think you're right. Even just talking to people in the interviews, Christopher, we saw, it seems like, a lot of centers that had a lot more resources and funding and paid staff were more equipped for the influx of callers that have been coming their way versus those centers that unfortunately were underfunded and also understaffed, and that relied on volunteers. So this is a great point, and I think something that the federal government needs to be aware of too, that there's kind of an imbalance on the burden of crisis centers, specifically with this funding piece. Okay. And I see that Kimberly also had a question. So when crisis responders and clinicians get caught up in trying to understand weapons, they often missing some of the most important piece is letting the caller be the expert on their weapon and partnering with them for safety. Collaboration is key, not knowledge about every firearm. Also very true. I think that was something that definitely has come out in the interviews too, is that ultimately it's really about the rapport of the crisis counselor and with the person who has the firearm. And you're correct. It really ultimately is up to the person what they want to do. I think just something we found from some of the interviewees is that they felt that some people might feel more comfortable and not panic if they have a little bit more knowledge about how a general firearm works. But like you said, ultimately the collaboration and the rapport is what is most important in those conversations. So great point. Okay, I see with Tabitha. So you're curious about whether the crisis staff have support from the organization they're working with and what that support looks like. So I'm not quite sure to be specific about support. I think it sounds like, I can't speak based on the findings, what support looks like across the board. I mean, I get the sense that, we talk to people who are counselors and we talk to people who are administrators at different centers. And it really seems like people, especially the administrators, had been crisis counselors themselves. So they're trying their best to, kind of understand what the crisis counselor might be dealing with in terms of stress. I think it's just, it sounds like even, the administrators are trying to anticipate so many different things, especially with these conversations, and that they're just, there might not just be enough time and energy for even them to create a training about firearm safety. And then some states, we heard where there's, stricter gun policy, they might not have a firearm, conversation come up very often. So that might just be a lower priority. But again, there's some states where that is, that's coming up more often too. So I think it's kind of the responsibility of those who are, those of us in research or who might want to partner with these crisis centers to support them to kind of produce these tools as well. Okay, I see there's some conversation too, about, willingness to have conversations, about guns too. I think the good thing is that when we have someone call, a crisis center, that means there might be that window of wanting to talk too. So that's something that I think, Kimberly, too, you mentioned, if we know that they want to talk, how can we kind of get in there and build that collaboration, and kind of help them separate from the firearm or help them, deal with their distress. How many people are working to be psychiatrists when limiting access to medications? Okay, same principle. So there's a conversation about that. And Lucy can be part of the discussion too.
My mic's been very wonky this whole time, so.
Mm-hmm. Do you want to add in your 2 cents, Lucy?
I mean, I think it varies. It's a very difficult situation in which you need to be comfortable talking about guns and talking to someone who has a gun in order to listen to them on what their knowledge is. I think in our interviews, it was very clear that the people who have experience with guns and who are gun owners are just more comfortable than having those kinds of conversations. So the knowledge is an important basis there.
Any other takeaways, Lucy? Are you just from looking at the? Oh, thank you, Christopher. Thanks. Yeah, social work team. Great. Any final thoughts, Lucy, before we wrap up?
I think we covered everything.
All right. Well, thank you all for joining, and thank you for your questions. It's always good to get questions, and you're always welcome to email us as well.
Awesome. Thanks a lot, Lucy and Nina.
All right.
A great presentation. Thanks to the audience for joining. You guys have a wonderful day. Enjoy your weekend.
Yep. Thanks. Bye.
Thanks.
Bye. Thank you.